Attacks, riots, and poor management. Some of the hallmarks of the Kentucky Juvenile Justice Audit released today. The report follows 3 lawsuits filed against the Adair County Juvenile Detention Center. WDRB's Richard Essex has been digging through the problems and possible solutions.
Well, the report is 231 pages and it does not read like a bestseller. It is scathing at best. In August of last year, the auditor's office started a performance review of the department's policies and procedures, and they found some of the most critical policies and procedures simply didn't exist or were quite simply being ignored.
Well, juvenile justice is the last chance for some of these kids to turn it around.
And according to this report, the system is failing. One of the most poignant points: recommendations made by the Center for Children's Law and Poverty organization in 2017 to improve Kentucky's juvenile detention system have not been followed. The use of force practices are not in line with national best practices and poorly deployed. The use of chemical spray and tasers have been done so without policy in place. The isolation policy is inconsistent and out of step with national best practice. Deplorable conditions and allegations of abuse at the Adair County Detention Center are being addressed with legal action.
The state has proven unable to address the problem. And so we're hoping that a federal court can intervene and get things back on track so that these kids actually have a chance at getting rehabilitated.
The report outlines poor medical and mental health record keeping, staffing shortages, ineffective training of staff, and nearly every program designed to rehabilitate juvenile offenders is failing. The report states that education must be a priority. The provision of education in detention is the primary form of rehab. The current system is classified as inconsistent, poorly implemented, and lacks oversight. The question I had for Representative Bratcher: is the documented lack of performance losing an opportunity to reform an entire generation?
Because once they turn 18, it's a whole new ballgame. And we have to, as a state, a commonwealth, make sure that this department gets turned in the right direction and save some of these kids.
The General Assembly is looking at putting some money towards this, $20 million in the 2025 fiscal year for primary and mental health care for juvenile justice, and nearly $8 million for some other programs.
Plus a big swath of money going into reopening the juvenile jail in Louisville. All right, Richard, thank you so much for your reporting tonight.